Do you have an idea of, and are there any studies that talk about the disconnect between us as physicians and providers, both as primary care docs, retina providers, or ophthalmologists, and the patients? Why is it that they're not going, despite all these programs and everybody talking about the fact that this needs to be done, why is it that there's this disconnect, that the patient doesn't go, half the patients don't go, they go see their primary care doc, but they then don't go see an eye care specialist?
Well, there are certainly a number of reasons for that. I would say in the United States, really, it's difficult to blame access for the majority of these. I think most patients really in the US are able to see an ophthalmologist, that they have someone that's reachable. I think one of the bigger problems is actually not access so much as it is that patients are asymptomatic until they're at a more advanced stage. And if they wait to come in when they already have their traction retinal detachment, then you're really way behind the curve. I think with so many things, preventative medicine, it's always a problem if you have 20/20 vision. If you have good vision, it's easy to say, "Oh, I'll go tomorrow," or "I'll go next week," and then it's put on the back burner until they realize I have a problem with my vision. Correct. And unfortunately, that's a little bit late.
I completely agree with you. I mean, still the leading cause of blindness in working-aged patients. I mean, these are people that are out there in the community. A lot of them have insurance, have access to care, just aren't making it in because they think they'll go when they start losing vision. And both of us as surgeons know we see traction retinal detachments, patients that are walking in blind, and it's a little bit of a challenge at that point to try to get them back. So even though we can fix them, the probability that they'll see normally is very small. Whereas if I was to tell you that I got you a patient with mild to moderate disease or even early severe disease, what do you think the probability today is, with all the treatments that we have, that we can keep them seeing well, functioning in society, and continuing to work rather than being disabled?
Well, certainly if we can see them in time, there really is no reason why in 2014 why diabetes or diabetic retinopathy should be the leading cause of vision loss among working age adults. I mean, we really have no way to rationalize that, and that absolutely should not be the case.
I agree with you. And that's why it's that much more frustrating. For some of these disease states, cancer is a very complicated disease, but for me, you've got things that are very devastating to patients. So if you talk to a patient after cancer, vision loss is probably the next highest thing that they worry about. Yet, we've got great solutions. We don't have great fixes for all cancers. We've got great solutions for diabetic retinopathy, vision loss today, yet half the patients aren't getting screened appropriately to be able to get to us.